Hey, future counselor, if you are studying and preparing to take an addiction counseling exam, you're working towards becoming a drug and alcohol counselor, or any type of addiction professional, this video is going to be very helpful for you. Today, we're going to walk through 50 addiction exam practice questions. It's going to cover all major topic areas that you find on addiction exams. We're also going to review the correct answers and the incorrect answers to improve your knowledge of all addiction exam topics. If you're new here, welcome. I'm Letitia, a licensed professional counselor and licensed substance abuse treatment professional. I provide mental health and substance use education and trainings, in addition to supporting future counselors just like you with studying and passing their addiction counseling exams. Let's get started. On today's practice exam, we'll cover all major topic areas that you find on all the addiction counseling exams, to include screening, intake assessment, treatment planning and implementation, counseling skills and interventions, documentation, discharge, and continuing care, and lastly, ethics, culture, and client safety. So basically, we'll be reviewing from screening to discharge, in addition to professional topics like safety, ethics, and culture. During screening, a client reports daily alcohol use and says, "I don't want treatment, I just need a letter for court." What is the counselor's best next step? Begin treatment planning to reduce legal consequences, clarify the client's goals and explain what screening can and can't do, confront denial and explain the risk of continued use, or refuse services unless the client agrees to abstinence. The correct answer is B. Clarify the client's goals and explain what screening can and can't do. B is correct because screening is the place to clarify purpose, review limits and expectations with the client, in addition to assessing their readiness, assessing their risk without jumping ahead. A is incorrect because treatment planning comes later. Screening is about seeing if the client would be a good fit, assessing their risk, and understanding what the next steps would be. C is incorrect because confronting a client too early can increase resistance. It can kind of mess up rapport as well. Also, screening is about engaging and clarifying. And D is incorrect because refusing services based on abstinence is not client-centered and can be seen as unsafe or ineffective. During intake, a client answers most questions with, "I don't know," and avoids eye contact. Which response is most appropriate? Continue to intake quickly to finish required paperwork? Pause and ask permission to slow down and explain why the questions matter? Interpret the behavior as manipulative and document that the client is being guarded? Or end the intake and reschedule when the client is more cooperative? The correct answer is B. Pause and ask permission to slow down and explain why the questions matter. B is correct because trauma-informed intakes include pacing, asking consent, and having transparency to improve engagement and accuracy. A is incorrect because speeding up often worsens the shutdown and reduces the accuracy of the intake. C is incorrect because manipulation is a judgment and we don't have enough data, so we don't want to make judgments too soon about the client. And D is incorrect because ending may feel like you're rejecting the client, and it's better to stabilize the process first. A counselor is trying to decide whether a question on the exam is about orientation or intake. Which clue best signals orientation? Explaining program rules, attendance, expectations, and confidentiality limits. Collecting detailed history of substance use patterns. Completing a biopsychosocial and mental status exam. Or selecting an ASAM level of care based on multidimensional assessment. The correct answer is A, explaining program rules, attendance expectations, and confidentiality limits. A is correct because the orientation is supposed to focus on explaining the service, the rules, the expectations of the program. B is incorrect because getting a detailed history belongs in the intake or assessment. C is incorrect because that is formal assessment work. And D is incorrect because level of care decisions occur after the assessment. A client reports using opioids and says, "I'm pregnant but don't want anyone to know." What is the counselor's best immediate focus during assessment? Assess safety and medical risk and coordinate appropriate referral and medical care. Explore the client's readiness to stop opioids and set abstinence goals. Continue the interview to complete all assessment sections first, or determine legal consequences and report to the authorities. The correct answer is A. Assess safety and medical risk and coordinate appropriate referral or medical care. A is correct because pregnancy plus opioid use signals a potential medical risk. Your biggest responsibility now is to ensure safety and coordinate care that comes next. B is incorrect because goals matter, but for later. Safety is the priority. C is incorrect because completing forms never will outweigh medical risk. And D is incorrect because legal action is not the first step without assessing laws and safety. Which statement best reflects good clinical assessment practice? Client is addicted and in denial. Client is non-compliant and not ready to change. Client reports daily use. Substance appears to function as a stress relief. Readiness is mixed. Or client has poor insight. Recommend discharge. The correct answer is C. Client reports daily use. Substance appears to function as stress relief and readiness is mixed. C is the correct answer because this entry is objective, it addresses the function, and it interprets the client's behavior without shaming. A is incorrect because we don't want to use labels without functional analysis of what the behavior is serving. B is incorrect because it's kind of judgmental and is vague. And D is incorrect because discharge is not supported by an assessment statement alone. You will need more information and you will have to show the reason for discharge. A client answers yes to past overdose and current benzodiazepine use, but denies risk. What is the counselor's best next step? Complete a targeted safety and risk assessment and determine level of care needs. Accept the denial to preserve rapport. Provide education only and move on, or begin relapse prevention planning immediately. The correct answer is A. Complete a targeted safety and risk assessment and determine level of care needs. A is correct because the client has reported past overdose history plus use that equals elevated risk. You must address safety first. B is incorrect because rapport does not replace risk assessment. C is incorrect because education alone does not manage or reduce risk. And D is incorrect because relapse prevention would not be appropriate at this moment. You will have to address safety first. Which intake action best supports accurate diagnosis later? Ask only yes/no questions to prevent confusion. Gather a timeline, first use, escalation, last use, and symptom patterns over time. Avoid asking about mental health until substance use is stabilized, or focus on legal history because it's most objective. The correct answer is B. Gather a timeline to learn about first use, escalation, last use, and symptom patterns over time. B is correct because timelines help us develop an accurate diagnosis and guide safe treatment. A is incorrect because yes/no answers don't provide us enough details, and it's hard to pick up patterns with yes/no answers. C is incorrect because modern practice focuses on assessing both at the same time, both mental health and substance use issues. And D is incorrect because it would be inappropriate to focus on legal history, and that doesn't mean it's going to be objective. A client speaks limited English and nods yes throughout intake. What is the most ethical approach? Use a qualified interpreter and confirm informed consent and understanding. Proceed since the client appears to be agreeable. Ask a family member to translate for comfort, or provide written forms only and obtain signatures. The correct answer is A. Use a qualified interpreter and confirm informed consent and understanding. A is correct because language access ensures informed consent, accuracy, and ethical care. B is incorrect because nodding does not equal understanding. C is incorrect because family interpreters risk confidentiality and accuracy. And D is incorrect because you cannot provide written forms only and obtain signatures if the client does not understand and does not give consent. Which is the best example of a screening outcome? A completed treatment plan with objectives, a diagnosis and level of care placement, a decision about eligibility, urgency, and next step referral, or a relapse prevention plan. The correct answer is C, a decision about eligibility, urgency, and next step referral. C is correct because screening determines if the client is fit, how urgent the care is, and what direction the services will go. A is incorrect because treatment planning comes later. B is incorrect because a diagnosis and placement require an assessment first. And D is incorrect because a relapse prevention plan would be involved in the treatment planning portion, and that will come later. A counselor suspects a client is minimizing substance use. Which approach is most appropriate during assessment? Accuse the client of lying, use open-ended questions, normalize disclosure, and explore inconsistencies, end the assessment due to poor insight, or ignore inconsistency to avoid conflict. The correct answer is B. Use open-ended questions, normalize disclosure, and explore inconsistencies. B is correct because as counselors and while we are completing assessments, it's supposed to be collaborative and non-judgmental. A is incorrect because accusations can damage rapport and you might not get the most accurate information. C is incorrect because minimizing is normal. It should be expected with clients who are struggling with substance use and have not accepted the effects of their substance use. So it's not a reason to end the assessment. And D is incorrect because ignoring inconsistencies can create an unsafe treatment planning. A treatment plan goal reads, client will improve coping skills. What is the best revision? Client will cope better with stress. Client will learn coping skills in therapy. By 12 weeks, client will use 2 coping skills during cravings at least 4 times weekly, tracked in a log. Or client will stop cravings. The correct answer is C. By 12 weeks, client will use 2 coping skills during cravings at least 4 times per week, tracked in a log. C is correct because it is a SMART goal. It's specific, it's measurable, you have a frequency, time frame, and it's realistic. A is incorrect because it's too vague and it's not measurable. B is incorrect because learn is not observable. D is incorrect because you cannot plan to eliminate cravings entirely. A client states, I just want to get my kids back. What is the best way to translate this into a clinical objective? A client will regain custody within 30 days. A client will complete 8 sessions and demonstrate competency. A client will comply with all court orders, or client will be motivated to change. The correct answer is B. Client will complete 8 sessions and demonstrate 3 parenting safe relapse prevention steps by week 10. B is correct because it focuses on skill-based, measurable behaviors tied to a larger goal. A is incorrect because custody outcomes are not fully within clinical control. C is incorrect because comply is vague. You need to be more specific about what it means to comply, and it's not a clinical skill. And D is incorrect because motivation is not measurable. A client says, I'm not sure I want to quit right now. What treatment planning approach is best? Develop harm reduction and motivation building objectives. Require abstinence-only goals. Delay treatment planning until motivation improves. Or focus primarily on consequences to increase fear. The correct answer is A. Develop harm reduction and motivation building objectives. A is correct because this meets the client where they are at while improving safety and engagement. B is incorrect because it's too rigid. Rigid planning often leads to dropout. C is incorrect because treatment planning can occur at all stages of readiness. And D is incorrect because you don't want to focus on consequences and you don't want to put fear in the client. You want to collaborate with them and support them with working towards recovery. Which objective best demonstrates implementation rather than planning alone? Client will identify triggers. Client will attend weekly sessions. Client will role play refusal skills twice monthly and report one real-world use weekly, or client will understand relapse prevention. The correct answer is C. Client will role play refusal skills twice monthly and report one real-world use weekly. C is correct because it incorporates practice and application. That equals implementing. A is incorrect because identification alone is not action. B is incorrect because attendance is not behavioral change. And D is incorrect because understanding and education alone would not be implementation. A client in early recovery requests immediate trauma processing. What is the best planning response? Begin trauma processing immediately. Prioritize stabilization goals first and revisit trauma timing later. Refuse trauma work entirely. Or refer out immediately without discussion. The correct answer is B. Prioritize stabilization goals first and revisit trauma timing later. B is correct because you want to stabilize before processing trauma. And essentially that's a safety question. So what do you need to do first to ensure the client is safe? A is incorrect because early trauma work may destabilize recovery. C is incorrect because trauma-informed care still will apply. And D is incorrect because you don't want to refer out immediately without discussion, without figuring out what would be best for the client. Which intervention best supports the objective, improve appointment follow-through? Create reminder systems and address transportation barriers. Tell the client attendance is required. Increase confrontation, or discuss motivation generally. The correct answer is A. Create reminder systems and address transportation barriers. A is correct because it targets real-world barriers with practical solutions. B is incorrect because rules don't fix barriers. C is incorrect because confrontation rarely improves attendance. And D is incorrect because barriers have nothing to do with motivation. A client can be motivated but have things in the way like transportation, money issues, family issues. These barriers do not, take away the fact that they need to be addressed. A client repeatedly relapses after payday. What should treatment planning focus on most? Revising diagnosis, increasing session length, identifying the payday pattern and building a structured high-risk plan, or encouraging stronger willpower. The correct answer is C, identifying the payday pattern and building a structured high-risk plan. C is correct because this involves identifying the trigger, developing a plan, a response to the trigger. That equals relapse prevention. A is incorrect because the pattern is a part of a behavior. It's not diagnostic. B is incorrect because more time does not equal targeted intervention. And D is incorrect because willpower and encouragement does not change things if you're not going to implement things to try to work towards the goal. Which statement best reflects person-centered yet structured treatment planning? Counselor determines goals to ensure compliance. Client determines all goals without guidance. Counselor and client collaborate on measurable goals aligned with client values, or treatment plan focuses on diagnosis labels. The correct answer is C. Counselor and client collaborate on measurable goals aligned with client values. C is correct because it encourages collaboration, so it involves the client and the counselor working together. A is incorrect because it's overly controlling. B is incorrect because the lack of structure may reduce effectiveness. And D is incorrect because your treatment plan should not focus on the diagnosis. You should not label the client. You should focus on, again, collaborating and figuring out ways to work towards the desired goal. A client shows steady improvement. What is the most appropriate treatment plan update? Keep the plan unchanged for consistency. Adjust objectives to reflect new needs and document rationale. Discharge immediately, or remove relapse prevention goals. The correct answer is B. Adjust objectives to reflect new needs and document rationale. B is correct because updates should match clinical reality. Your treatment planning is a live document, it's ongoing, it should change as many times as needed. A is incorrect because plans should evolve with progress. C is incorrect because discharge requires stability in planning. And D is incorrect because you wouldn't want to remove relapse prevention goals. That's the whole point of the addiction counseling treatment plan, to support them with maintaining relapse. A client states, I'm only here because probation made me. What planning approach is best? Link legal requirements to the client's personal values and outcomes. Focus only on probation compliance. Tell the client motivation is required, or delay goal setting until voluntary. The correct answer is A. Link legal requirements to the client's personal values and outcomes. A is correct because you want to support them with building motivation that comes from them, from what they want and what they need. B is incorrect because compliance alone does not sustain change. C is incorrect because shaming sometimes will reduce engagement and that'll make them not want to participate. And D is incorrect because you don't want to delay goal setting. You want to work with them, collaborate with them. A client says, I relapsed because I'm weak. Which counselor response best reflects a CBT approach? Explore unresolved childhood conflicts related to self-worth. Challenge the belief as irrational and tell the client to replace it. Identify the thought, test its accuracy, and build a coping response plan. Or emphasize personal responsibility and choice. The correct answer is C. Identify the thought, test its accuracy, and build a coping response plan. C is correct because CBT addresses thoughts, tests them, and builds skills in order to change behaviors. So CBT, you're going to see things about thoughts and behaviors. A is incorrect because that's a more psychodynamic focus, not CBT. B is more related to rational emotive behavior therapy and it's confrontational. And D is incorrect because emphasizing responsibility and choice would not be a component of CBT. A client states, everyone judges me, so why even try? Which response best reflects motivational interviewing? That's a cognitive distortion we need to correct. You're making excuses to keep using. It sounds exhausting to feel judged, and part of you still wants things to change. Or you should stop worrying about what people think. The correct answer is C. It sounds exhausting to feel judged, and part of you still wants things to change. C is correct because you're using a reflection of feelings plus support equals motivation interviewing. A is incorrect because it's accurate, but it's too direct for motivational interviewing. B is incorrect because it may increase resistance. And D is incorrect because you are telling the client what to do, it's kind of borderline, gives advice, and it's not empathetic. During group therapy, one member dominates discussion and gives unsolicited advice. What is the best counselor intervention? Allow it to continue because peer feedback is helpful. Confront the member for controlling behavior. Redirect the group norms and invite balanced participation, or end group early to prevent conflict. The correct answer is C. Redirect group norms and invite balanced participation. C is correct because it uses structure and norms appropriately. A is incorrect because dominance reduces group safety. B is incorrect because it might escalate defensiveness. And D is incorrect because you don't want to end group to prevent conflict. You want to model for them how to appropriately address conflict. A client reports intense cravings every evening. Which intervention is most appropriate? Explore dream content related to cravings. Develop an evening routine and practice urge surfing skills. Encourage thought suppression, or emphasize consequences of relapse. The correct answer is B. develop an evening routine and practice urge surfing skills. B is correct because skills included with high-risk timing equals an effective intervention. A is incorrect because it's not targeted to cravings management. C is incorrect because suppression often can increase cravings. And D is incorrect because emphasizing consequences is not going to necessarily prevent relapse. A client says, I drank because my friend texted me. Which response best reflects behavior therapy? Explore what the text symbolized emotionally. Identify the antecedent behavior consequence chain and modify reinforcement. Encourage cutting off all social relationships. Or practice emotional acceptance. The correct answer is B. Identify the antecedent behavior consequence chain and modify reinforcement. B is correct because this is a core foundational idea of behavior therapy. A is incorrect because this is insight oriented. C is incorrect because it's oversimplified. And D is incorrect because this is not a behavior therapy concept. A client repeatedly breaks goals and says, I hate myself. What is the best counselor response? Increase accountability through confrontation. Validate emotion and shift to skill building with achievable steps. Ignore the statement to avoid reinforcing negativity, or interpret it as a personality disorder. The correct answer is B. Validate emotion and shift to skill building with achievable steps. B is correct because it encompasses empathy plus skill building, which can encourage self-efficacy. A is incorrect because shame increases relapse risk. C is incorrect because ignoring may also increase risk. And D is incorrect because you cannot diagnose or interpret it as a personality disorder. That will not meet criteria for that. A client is visibly dysregulated, breathing rapidly, and states, I can't do this. What should the counselor do first? Conduct a full relapse analysis, teach a brief grounding or regulation strategy, implement a behavior contract, or continue the planned session agenda. The correct answer is B. Teach a brief grounding or regulation strategy. B is correct because stabilization is the immediate priority. A is incorrect because analysis comes after regulation. C is incorrect because contracts do not regulate the nervous system. And D is incorrect because it would not be the safest intervention or choice to continue the session without addressing the immediate need of the client. A client says, I want recovery, but I'm not ready to lose my friends. Best counseling focus, require immediate social cutoff, explore values and develop safer boundaries, ignore the social factor, or emphasize abstinence only. The correct answer is B. Explore values and develop safer boundaries. B is correct because it balances values, safety, and readiness. A is incorrect because forced change often backfires. C is incorrect because social context is a major relapse factor. And D is incorrect because abstinence only may not be the best route or goal for this particular client. And it may even often trigger relapse. Which counselor behavior most reflects a person-centered approach? Direct advice and firm confrontation, empathy, genuineness, and unconditional positive regard, strict rule enforcement, or interpretation of unconscious conflict. The correct answer is B, empathy, genuineness, and unconditional positive regard. B is correct because it's a core Rogers principle. It's classic person-centered. A is incorrect because it's direct and is not person-centered. C is incorrect because this is more behavioral management. And D is incorrect because this is not a core principle of person-centered approach. A client says, if I relapse once, I might as well give up. What intervention is best? Reframe all or nothing thinking and normalize relapse as learning data. Increase accountability by threatening discharge. avoid discussing relapse, or agree relapse means lack of motivation. Which progress note entry best reflects high quality clinical documentation? Client did well, session went fine. Client was resistant and non-compliant. Client reported 2 cravings this week, used coping plan, no substance use, safety assessed. Or client has ongoing issues. The correct answer is C. Client reported 2 cravings this week, used coping plan, no substance use, and safety assessed. C is correct because it has specific data, an intervention, a response, and address safety. A is incorrect because it's too vague and it's non-clinical. B is incorrect because it's judgmental without behavioral detail. And D is incorrect because it's too vague and it doesn't specify the client's quote-unquote ongoing issues, and it does not address safety either. When writing an assessment summary, which element is most important? Counselor's opinion about client motivation, clear linkage between symptoms, substance use, functioning, and recommendations, client self-report only without interpretation, or diagnostic labels without supporting evidence. The correct answer is B, clear linkage between symptoms, substance use, functioning, and recommendations. B is correct because this demonstrates assessment and treatment rationale. A is incorrect because opinions are not clinical reasoning. C is incorrect because notes require professional analysis. And D is incorrect because diagnostic labels without supporting evidence would not be effective clinical reasoning. Case management is best defined as providing psychotherapy at every contact, coordinating services and resources to reduce treatment barriers, diagnosing co-occurring disorders, or conducting crisis intervention only. The correct answer is B, coordinating services and resources to reduce treatment barriers. B is correct because this is the accurate definition of case management. A is incorrect because therapy is not the core function of case management. C is incorrect because diagnosis is assessment, not case management. And D is incorrect because crisis intervention is not a part of case management. A client repeatedly misses sessions due to transportation issues. What is the best documentation approach? Client lacks motivation. Client is refusing treatment. Transportation barrier identified, case management steps initiated, and follow-up planned. Or client non-compliant, discharge recommended. The correct answer is C. Transportation barrier identified, case management steps initiated, and follow-up planned. C is correct because it identifies the barrier, mentions an intervention, and plan. A is incorrect because it assumes and is also judgmental. B is incorrect because missed sessions does not equal a refusal. And D is incorrect because having a barrier like transportation or a money issue does not equal non-compliance, and you would not discharge. Which scenario best supports discharge from services? Client attended several sessions. Client reports feeling better 1 week. Goals largely met. Risk stable. Continuing care plan in place. Or client requests to end services immediately. The correct answer is C. Goals largely met. Risk stable. Continuing care plan in place. C is correct because it addresses progress, safety, and continuance of care. A is incorrect because attendance does not equal progress. B is incorrect because a single report does not show stability. And D would be incorrect because client requests to end services immediately does not support discharge from services. A client is relocating to another country after discharge. What is the best continuing care action? Provide no referrals to encourage independence. Offer general advice to avoid triggers. Provide warm handoff referrals and document coordination steps. Or delay discharge until the client returns. The correct answer is C. Provide warm handoff referrals and document coordination steps. C is correct because warm handoffs support continuance of care and safety. A is incorrect because withholding resources increases relapse. B is incorrect because this is too vague to support care. And D is incorrect because you can't delay discharge until the client returns. You have to address the client, support the client with continuance of care wherever they're going. Another provider requests all records for a shared client. What is the best response? Release everything to support collaboration. Release only the valid consent and minimum necessary information. Refuse the request entirely. Or release records based on verbal agreement. The correct answer is B. Release only with valid consent and minimum necessary information. B is the correct answer because it protects the client's confidentiality and rights. A is incorrect because it violates the privacy standards. C is incorrect because it blocks the appropriate care coordination. And D is incorrect because you cannot release records with a verbal agreement only. Which note entry best distinguishes observation from interpretation? Client was manipulative and evasive. Client avoided eye contact and reported anxiety at 8:10. Client was lying about substance use. Or client is a poor historian. The correct answer is B. Client avoided eye contact and reported anxiety 8 out of 10. B is correct because it's observable behavior plus client report. A is incorrect because this is subjective and judgmental. C is incorrect because it's like you're accusing the client without evidence. And D is incorrect because you're basically saying that the client is lying or they're not remembering details correctly. A counselor documents client denies suicidal ideation. If risk remains a concern, what documentation is most appropriate next? Stop documenting to reduce liability. Document risk factors, assess protective factors, and response plan. Record only the client's denial or state that the client is safe. The correct answer is B. Document risk factors assessed, protective factors, and response plans. B is correct because it shows appropriate risk assessment and action. A is correct because, no, A is incorrect, my apologies, because this increases liability. C is incorrect because denial alone is insufficient. And D is incorrect because you cannot document inaccurate information. You do not know if the client is safe. Which statement best reflects golden thread documentation? Goals remain unchanged for consistency. Assessment data links directly to goals, interventions, and progress updates. Notes focus primarily on counselor actions, or goals are documented only at discharge. The correct answer is B. Assessment data links directly to goals, interventions, and progress updates. B is correct because this demonstrates clear continuance of care across documentation. A is incorrect because goals should evolve with the data. C is incorrect because notes should reflect client response. And D is incorrect because goals should be updated as the service is provided, not only at discharge. A client offers an expensive gift to the counselor to say thank you. What is the best response? Accept the gift to avoid harming rapport. Decline the gift and explore boundaries and meaning with the client. Accept the gift and document it. Or suggest the client donate the money instead. The correct answer is B. Decline the gift and explore boundaries and meaning with the client. B is correct because ethical practice maintains boundaries with therapeutic exploring meaning. A is incorrect because accepting expensive gifts risks boundary violations and conflicts of interest. C is incorrect because documentation does not resolve the boundary issue. And D is incorrect because you cannot tell the client what to do with the money or the gift, nor can you accept the gift. A client states, if they keep talking about me, I'll hurt someone. What is the counselor's best next step? Promise confidentiality to keep the client engaged. Conduct a targeted risk assessment and follow duty to protect procedures. Ignore the statement unless a weapon is mentioned, or shift focus to coping skills. The correct answer is B. Conduct a targeted risk assessment and follow duty to protect procedures. B is correct because safety and legal ethical obligations require assessment and action. A is incorrect because confidentiality cannot be promised when safety threats are present. C is incorrect because threats require evaluation regardless of weapon mention. D is incorrect because you cannot ignore a safety threat. A counselor posts on social media, proud of a client for 30 days sober, without using a name. Which ethical concern is most relevant? Dual relationships, scope of practice, confidentiality, or counselor self-disclosure? The correct answer is C, confidentiality. C is correct because indirect identifiers can still breach confidentiality. A is incorrect because no second role is established. B is incorrect because no scope issue is present. And D is incorrect because the counselor did not disclose or share anything about themselves. A client avoids eye contact during sessions, which aligns with their cultural norms. What is the most appropriate counselor response? Document the behavior as resistance. Ask the client to practice eye contact. Explore the behavior without assigning meaning. Or redirect the client to stay engaged. The correct answer is C, explore the behavior without assigning meaning. C is correct because this demonstrates cultural humility and curiosity. A is incorrect because this labels the behavior without context. B is incorrect because it imposes your norms, the counselor's norms. And D is incorrect because you are redirecting the client to stay engaged without asking about the behavior, or you're assuming that the behavior is them not being engaged. A client asks the counselor to also serve as their recovery sponsor. What is the best response? Agree if it supports recovery. Decline and assist the client in finding support. Accept temporarily with documentation. Or accept if the client requests it. The correct answer is B. Decline and assist the client in finding support. B is correct because it maintains boundaries while supporting recovery. A is incorrect because this creates a dual relationship. C is incorrect because temporary dual roles are still unethical. And B is incorrect because you cannot accept the client request if it violates dual relationship rules or ethical rules and boundaries. A counselor lacks training to treat a co-occurring eating disorder that is worsening substance use. What is the most appropriate action? Continue treatment to avoid disruption. Focus only on substance use. End services immediately. Or seek supervision and coordinate referral. The correct answer is D. Seek supervision and coordinate referral. D is correct because consultation and coordinated referral protects the client. A is incorrect because practicing outside of competence risks harming the client. B is incorrect because ignoring co-occurring issues can compromise the care. And C is incorrect because you can't just abruptly terminate. It's unethical. A client says, if you document my relapse, I won't come back. What is the best response? Agree not to document. Explain documentation requirements and explore concerns. Warn the client about consequences. Or avoid discussing the relapse. The correct answer is B. Explain documentation requirements and explore concerns. B is correct because transparency and empathy support ethical care. A is incorrect because accurate documentation is required. C is incorrect because threats increase resistance. And D is incorrect because you cannot avoid conversations about the care and the recovery of the client. A client admits using someone else's prescription medication. What is the best counselor response? Demand immediate cessation, assess safety and provide education, ignore unless withdrawal symptoms appear, or advise reducing the dose. The correct answer is B. Assess safety and provide education. B is correct because assessment and education are within your scope. A is incorrect because these types of directives may be unsafe. C is incorrect because risk exists even without withdrawal. And D is incorrect because advising reducing the dose is not working within your scope of experience or licensing. A counselor feels ongoing irritation towards a client. What is the most appropriate professional response? Increase confrontation, reduce session frequency, seek supervision and self-reflect, or transfer the client immediately. The correct answer is C. Seek supervision and self-reflect. Supervision addresses countertransference ethically. A is incorrect because this can escalate the relationship, the therapeutic relationship. B is incorrect because avoidance does not address the issue. And C is incorrect because it's also a type of avoidance and you can cause harm to the client care by just immediately transferring. A client asks the counselor, "Are you religious?" What is the best response? Share personal beliefs, decline to answer, explore the meaning of the question, or state religion is not relevant. The correct answer is C. Explore the meaning of the question. C is correct because this keeps the interaction client-centered and ethical. A is incorrect because this shifts focus away from the client. B is incorrect because this type of refuser may harm rapport. And D is incorrect because avoiding talking about the question or keeping the conversation centered on the client may harm the therapeutic relationship, or it may harm or interfere with the care of the client. Working through these types of practice exam questions helps you build your critical thinking skills. You were able to prioritize safety, navigate ethical situations, and make sound clinical decisions through every question. Make sure you are subscribed so you don't miss the next set of questions. Thank you for watching.